We're going to discuss pertussis now. Pertussis is caused by Bordetella pertussis. It is a very contagious disease. It is spread by droplets. You do not have long-term immunity. We used to think that, but we figure that now it's about 10 years. So we know that if you get pertussis, you can still get pertussis later on in life. You still need immunization. It's also recommended now that we repeat immunizations in older children. Formerly, we used to say no pertussis after 7 years of age. Now we give a smaller, half a dose, basically, in older children, and it's also recommended in adults. It's also known as whooping cough. When you're reading the test question, look for incomplete immunizations. That's one first important clue. And then go through the different stages of the disease. The disease goes through what's called the catarrhal stage, kind of like a cold, but they will have conjunctivitis. And conjunctivitis is another important clue when you're reading the test question. After a couple of weeks of the catarrhal stage, they go into what's known as the paroxysmal stage, and they have these really vicious paroxysms of coughing that go on in an older child, can go on for a real long time. And at the end of the coughing, they will have an inspiratory whoop. Now, the whoop is not always present in a younger child because infants and younger children may not develop those kind of pressures. And then after 2 to 5 weeks of these coughing spasms, they go into the convalescent phase. And the convalescent phase is basically the coughing gets less and less. The paroxysms become farther apart. The history and physical is extremely important. Look for a history of delayed or absent immunizations. The gold standard for diagnosis is a culture. You can do immune fluorescent antibodies, but the gold standard is the culture. We used to do what's called the cough plate. The characteristic cough goes like this. And they have that whoop at the end. I'm glad it's on tape now so I don't have to do it every single time. They can have facial petechia. If you zoom in, you might get those. They can have petechia from coughing so much. And it's basically the petechia will be in the face and the upper chest. And they can actually have subconjunctival hemorrhages, again, from the increased pressure from coughing. Now, I just did that for a couple of seconds. These kids have that for a longer period of time, and they'll have multiple episodes throughout the day, and this can go on for several weeks. Infants can actually have this and have periods of apnea, and they sometimes require intubation and mechanical ventilation. You can do PCR testing, and like I said, the fluorescent antibody test, but the best test is going to be culture. There's another really important, helpful hint in the diagnosis of pertussis, and that's your CBC. You will see a white blood cell count that's elevated, but as opposed to most bacteria, you will have a lymphocytosis. With bacterial infections, you'll see elevated white counts and the polys will be increased. But in this case, with pertussis, you will see what they call leukocytosis with lymphocytosis. So the white counts can be 20, 30, 40, 50, 60, 70,000. The highest I've had was like almost 100,000. And they have like 90% lymphocytes. So look for a high white count, but when you look at the differential, it's going to be mostly lymphocytes. You put that together with the rest of the history we've just discussed, you should be really, really suspicious for pertussis. No other bacteria, essentially, will give a white count with a differential like that one. The treatment of pertussis is actually supportive. You give the patient erythromycin, but erythromycin does not change the course of the disease. Erythromycin prevents that patient from giving the disease to somebody else, but it does not change the course of the disease for the poor patient that has it already. You should treat all household contacts also with erythromycin, and if they've not had recent immunizations, they probably need a booster of the pertussis.